about getting into my skin. Yeah, you know, those things that get into your skin like Bernard here. Yeah, but anyway, we're going to solve his problem in just a moment. We're back on the Monday edition of Morning Barbados, and always it's good to see Dr. Andrew Ford, who's a resident dermatologist. Good morning.
Hi, good morning, Doug.
How are you doing?
Sandra and the viewers. I'm
Well,
good.
Good. I'm glad. It's alopecia. Am I pronouncing it correctly?
Yeah, you're pronouncing it correctly. We're talking about a form of alopecia today called Alopecia Areata. So I had to add in another word that would be difficult for you.
Well, you gave me a jump start, and I'm happy with that. And, you know, little birdie told me it has to do with hair loss.
Yes, the definition of alopecia is hair loss, but the specific one called alopecia areata is an autoimmune form of hair loss. So, you know, these autoimmune conditions, the body doesn't recognize parts of itself and tends to cause inflammation and attacks that area. So alopecia areata is a specific form, and like most other forms of autoimmune hair loss, we don't know a lot about it, and so we speculate about why it happens. And you know, stress, we were talking about stress management. A stressful event often gets blamed for it. But the reality is we don't know why people get alopecia areata.
Wow, that is bizarre. Good morning, Cassandra. How are you, my dear?
I'm all right.
She's not stressed, and she doesn't have alopecia areata.
Not right now. Not right now on either count, thank goodness for those small mercies. But yeah, so is someone in particular predisposed to this? Is there an age or gender that it affects?
Well, it affects all age groups, but it often happens to very young, like in childhood time, also older age groups. It tends also to affect individuals who have Down syndrome, and sometimes people who have eczema or an atopy or sensitivity to the environment. But it's something that occurs just out of the blue. It's usually something that the individual doesn't recognize. For women, usually the hairdresser will recognize it, or sometimes for men, the barber would recognize it, because there are no symptoms. You don't feel anything. There are no sensations or burning or tenderness. You just realize one day that you're missing some hair, and it tends to be circular hair loss.
Wow.
Circular hair loss, so you can have it.
Patches.
Yes,
Yeah.
yeah.
And it just comes out. Just
Yes, the hair falls out, and then what's left is a smooth, perfectly smooth-looking area of the scalp.
Wow. Okay.
Is it a common problem in Barbados?
Well, yes, I think it isn't rare, but you don't see a new person with alopecia areata every month. But certainly every year we see new individuals with alopecia areata, and since it can be recurrent, you can get persons you've seen before having it again.
So since you had to add the areata, are there different types?
Yes, there are different types of alopecia. They can be classified as scarring or non-scarring, or you can define them as diffuse or focal. So there are different ways of classifying alopecia, but alopecia areata is a non-scarring alopecia, which usually resolves.
It's a nice clean finish.
Yes.
Yeah. So
That's the one you want to get.
Well, there are some benefits to it, I suppose, if you can say that. Like in Bernard's case, when all the hair is gone, you haven't got to worry about shaving at all.
Yes, so he can get up and he'll be ready faster than everyone else. Anyway.
That's a nice way of putting it. I think some ladies would like to get that on some areas, but you know, certainly not up there. But
yeah,
no, like your legs, you prefer not to have to go through the torture of shaving and waxing and all that.
But is it only a head thing?
Yeah, the alopecia areata can occur anywhere on your body.
Oh,
Really?
okay.
And but the scalp is the most common area. But of course, in the men, you can have alopecia areata in the beard area. You can also have it in the eyebrows. If you're unlucky, it can be what's called alopecia totalis, where you have alopecia of the scalp and the eyebrows and the beard, everything is gone. And then it can be universal, where you have all your hair just comes out. Of course, with the severity of the condition, when you have more hair loss, it's more severe. It's less likely for it to resolve.
But how do you treat it?
Well, the methods of treating autoimmune conditions usually revolve around trying to reduce inflammation. So, of course, in alopecia areata, you can use topical treatments which involve the use of corticosteroids, which are medications which reduce inflammatory responses and the immune system. So using a topical steroid, you have to use them, rub them on for at least 2 months to start to see some hair growth. Usually around 4 months, 6 months, that works pretty well. Another method is to actually introduce the steroid into the skin because there are white cells that are collecting around the base of the hair follicles, and these white cells actually inhibit and make the hair fall out. So that one requires injections. It's fine for small areas, but if you have an expansive hair loss, let's say a large area of the scalp, then it is a bit uncomfortable to have so many injections spaced about 1 centimeter apart. But the injection treatment tends to work quite well.
Okay.
I don't want to change the subject, but when I see all those ads on TV with balding men getting their hair back, the hair club and all those other people, is that real? Is that possible?
Well, in a lot of cases, they use appliances, which is one way of treating.
Let's say appliances.
You mean things?
Yes,
you mean
can,
like a piece?
you can put things on, and then
But they talk
are,
about stimulating the
It
follicle
goes-
so that it grows.
well, people try changing the blood supply and increasing it, but and then there's hair transplantation, which is
Yes.
probably the most efficient way of treating some non-scarring causes of balding.
When you transplant hair, does it grow?
Yes,
I
it
mean,
does. They just take 3 strands at a time. It's under microscopic guidance. They take little pieces out and put them into areas of the scalp that you require it.
Really?
Yeah, so
That's
there's
That
hope
might
for
seem
me.
weird because
Yes,
when you transplant
yeah.
anything, usually it would grow. But I was just
there,
wondering
there's
if it
some
was
people who are
hair.
great with our type of hair too. There are some
Okay.
specialists that
so
are
I,
good.
I can get curly hair transplanted?
You can get anything you want.
like Cassandra's.
Get lettuce. Get lettuce, man. Oh my goodness, that would be too funny
But
though.
some of the other treatments for alopecia areata would also include taking oral steroids, but oral steroids have a lot of side effects with obesity and also unmasking diabetes and that sort of thing. And sometimes you can induce an irritant reaction or an eczema type contact reaction that tries to stimulate the immune system so that the hair would start to grow back.
I never realized how many candidates for hair transplantation we have.
Yes.
Here. I just started glancing around the room.
Well, don't look at me.
Oh.
I still have a few.
Okay, that's good. So
People-
can
people-
you transplant your own hair to other?
Usually when you get a hair transplant,
your own?
it's your own
It's
hair.
your own
hair.
They have harvest sites where, I mean, it's
Site.
unlikely.
Harvest sites,
Most
wow.
people would still keep their hair around the borders and the back. So that's a good place to get hair from when you are doing hair transplant.
Okay, because that will grow back, so
Yes.
you won't create alopecia. You know, I was watching an interview recently, and this wasn't a case of hair loss, but this actor, The Rock, was preparing for the Hercules character, and he actually had to get the hair was built just for his face, and they took it from the testes of a yak.
Okay,
Yeah.
well, that's
I was just wondering about other harvest sites, if you know.
Well, it's for the hair transplantation. It's only the scalp, but that would have been an appliance, a kind of a prop, wigs
Yeah.
and that sort of thing. So that would have been applied.
So it's
Luckily
very
for the
soft.
luckily for the movies, you can get anything you want within an hour.
Within an hour.
Yeah, the right budget,
Key
you
thing.
certainly can.
Very nice. So how do we really manage this, though? I mean, Doug talked about all the offerings that are out there, but generally, what is the process of managing and treating? You mentioned
Well,
steroids.
first of all, you need the diagnosis because there's so many different types of alopecia. You need your doctor to be able to make the difference. This one is usually made just clinically, and then there's some findings we call an exclamation mark hair, which is a 1 to 2 millimeter long hair with a thicker end and a slim base. But in addition to the treatments that I mentioned, the topical ones, the injections, the oral ones, there's sometimes you need some psychological therapy too, because it is kind of devastating, from just from meeting other people and stuff, not having your hair. That's important for a lot of people. So I mean, stress is everywhere and in many forms. So even
That's
losing
why
your
we
hair
started
can be.
with the doc about managing it.
Managing stress.
Yeah.
Yeah, we all need to learn how to do that, don't we?
But does it get progressively worse?
Well, it is unpredictable, but there are some things that can give you an idea. If you get many oval spots of hair loss, 5 or 6, then that's not a good sign. If you get it before puberty, that's not a good sign. If you happen to have Down syndrome, that too isn't good. If it involves a part of the hairline, loss of the hairline is also a very poor prognostic factor. So some of these factors, the more bad prognostic factors you have, the more likely it is to get worse. So if you get like total hair loss on the scalp, or if you get recurrences. All these things point to a poor prognosis where you'll always have to seek treatment. But in most cases, almost everyone resolves. In the time I've been back in Barbados since '97, I only know of 2 patients who have remained almost totally devoid of hair on the scalp.
So there you go. There is hope for you to see a dermatologist. If you have any questions about the question of alopecia, this is the time to give us a call, 228-5562, 228-5563. We're going to take a break and come back with our discussion with our doctor in just a moment.
Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you. Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
We're back at 25 minutes before the hour of 7 o'clock on Monday morning. Dr. Andrew Ford, or dermatologist, is here discussing alopecia. Remember, if you have some concerns about sudden hair loss, or something that looks like it's coming loose on the head, give us a call, 228-5562, 228-5563. I'm sure he can put your mind at ease. During the break, Cassandra, you were asking the question about
existing diseases. I know you mentioned if you have Down syndrome, that starts a problem, but what about other conditions? If people have other things like maybe lupus or anything like that, does that make it more difficult to deal with?
No, but there's an association and an interconnection, especially if you have a family history of autoimmune conditions, that they can be concomitant autoimmune conditions. So things like vitiligo. There's also a type of anemia called pernicious anemia that some people can have as well. So the body's tendency to want to attack itself can be somewhat genetic. But we did mention Down syndrome. Some people have atopy. But the thing is, if you happen to be one of the unfortunate ones to get alopecia areata, the news is quite good, because unless you have a lot of them or lots of recurrences or hairline involvement, you will do well. A lot of young people get it, as I mentioned. Sometimes I've seen infants with it, young school age guys and girls, and most of them do well. You see them on the streets or see them somewhere else, they're happy, they've forgotten about their episodes of alopecia areata. So the outlook generally is very good, unless you have large areas involved or lots of recurrences.
What is the type where you said everything, all the hair goes, and does that include the eyelashes?
Yeah, there's the totalis type where you lose all the hair on your scalp, but the universalis, which means universally you lose all the hair, that would solve a shaving problem for sure, wouldn't it?
Yeah, but create ananother one.
Yes.
Doesn't that make it difficult then for your eyes and dust and that kind of thing?
Yes, well, certainly, yes, it would make a problem. So, you have all these eyelashes. It's easier for women, or for men, you may have to clip the eyelashes. They have to be using adhesive or some sort of glue to put them on. And you can have reactions to these glues and that sort of thing. And, wigs, hair pieces, that sort of thing would be necessary as well, especially if you're a woman.
All right, we've got a call on the line. Good morning. Hello.
Treat alopecia caused by chemical treatment.
Okay. Well, alopecia caused by chemical treatments, it depends on the amount of damage that occurs. If you have a chemical injury that's a full thickness injury that can get to the root of the hair, then it may be a scarring, permanent injury. If it's just superficial, let's say you get a little burn from your relaxer, or if you're texturizing, then it will be superficial. You should heal very well. The only thing you have to manage initially is the epidermal or the surface injury, which may be a blistering or peeling. So moisturizing, you may have to use antibiotics to prevent secondary infection. But once it's superficial, it will heal. You will have some discoloration initially, but most chemical injuries, as I said, once superficial, heal. Another thing that happens to a lot of people, we mentioned in another program, is using lots of dyes on the scalp.
Right.
You can get a contact dermatitis, which can be very irritating. It can be exudative or give out lots of fluid and can cause swelling and lots of irritation. But mostly it would be burns, either from a hot appliance used in the hair or from the chemical.
Now, can you exacerbate it by rubbing, scratching, or brushing the spot?
No, the hair that's going to come out in alopecia areata is going to come out. It's just a matter of when it's going to come out. Initially, it's going to fall out rapidly. But usually when you have an oval area of hair loss, it tends to want to extend. So when you're doing the treatment, you should treat maybe a centimeter
On the
around
outside,
it.
yeah.
And if you're doing your injections, we usually go a little further outside the lesion just to make sure that those areas are taken care of.
Let me ask a question about possible self-induced
Alopecia.
alopecia, because ladies get a lot of braids and often they're very tight.
Yes.
They're weaves that if they're not done correctly or removed correctly, you can kind of see people with like missing hair and a painted on hairline.
Yes.
What is there hope to get that replaced? Can
Well,
that be fixed?
it has to be addressed very early because that's what you call attraction alopecia.
Yeah, it just
or
keeps
it's called
receding.
frontal marginal alopecia, where you get loss of the hair in this area. And if you walk around town or around Barbados, you realize that many women are starting to have this.
Yes.
And at a
They're
certain
painted.
And
point,
they're painting it on.
well, some people paint it on, they still have hair. I guess it's a fashion thing. But if you get to the stage where the area of the scalp looks smooth, you're probably too late already. But the thing with traction is that the black hair is some of the weakest hair compared to the other races. And the hair that is pulled in all of our pull-in styles, braids, locks, especially if you have the very small locks or the very big locks and they're always under tension from pulling the hair back, you sequentially lose the hair that's at the very edge, and it keeps popping and breaking. And after a while, the hair stops responding, it stops growing, and you get patchy hair loss. When you look at that area of the scalp, under magnification, you realize that the hair follicles are gone. And once you've lost your hair follicles, then
That's it.
you need to have a hair transplant for that. So all these pulling styles that we use, the locks, the braids, is something that we have to be very careful of. And we should never have our hair pulled too tightly or for long periods of time.
That you can't change
unless
your
you
expression.
unless you have very, if your hair is very strong and very thick, you can get away with it. But most people over time, especially as with advancing age, will lose more and more hair in that area.
Why haven't we heard about this before?
About
the
what?
About the kind of damage you can do to
attraction
yourself.
alopecia.
Yeah.
I think that's something that we see so much and maybe we take it for granted. But the thing is, by the time the individual goes to the doctor, it's the hairstyle that caused it has been discontinued because they've been trying to hide it with some other new method. And we don't appreciate from the time we're at school and little girls, everybody gets their hair braided, and you have to be really careful with how
Yeah,
you.
but
you
if
do
I
stuff with
didn't
your hair.
have oriental-shaped
Yeah.
eyes before my hairstyle, I'm thinking I shouldn't feel it happening while I'm getting the hairstyle. You know what I mean?
But when you look at someone who has their hair done too tightly, you ask them, does that hurt? They invariably say
They're
no.
like, no, but still they're like this.
I thought it was just dirty hair.
Oh, that too. Who knows?
Yeah, it seems as though they get an itch and slapping it helps a lot.
Oh dear, dear,
See a lot of
dear.
people driving and doing that.
Yeah,
Yeah, it's strange.
I said, why would you put yourself through something like that?
I don't know that.
Beauty, Doug. Beauty.
No.
Is that what it is?
No, but seriously, there are some styles. They look really pretty, but the braid is done in such a way it just pulls and it will pull. But I can't handle it. Some people will say just what you said, beauty comes with pain, and they believe that, so they bear it. They're burning away the scalp, but they're saying, yeah, beauty comes with pain, so they bear it.
That
But
reminds me, if you give a dance, you have to pay the band.
guess so. Yeah. So things to note: if it's feeling that uncomfortably tight, you really shouldn't be doing that to your hair because you're losing hair, and eventually it's going to say, "Oh well, why bother to grow?" Yeah.
So alopecia We talked about treatment using steroids. Is there some old-fashioned remedy? You know, the granny always had a cure for something. Does that work? And what is it?
No, there are no old-fashioned remedies because autoimmune conditions are very puzzling. Some people have, you see, when you have an autoimmune condition, people try all sorts of things. So the same thing that's used for male pattern baldness, minoxidil has been tried. And you know, if you look at a list of treatments that have been used for alopecia areata, the list is quite long. So that just points to the ineffectiveness of many of the treatments, except for the anti-inflammatory immunosuppressive treatments to the area. Maybe with time we will learn more. I'm sure that lasers will come on. They're doing lots of research with lasers. Some treatments that will stimulate the immune system. We'll come up with that. Lots of stem cell research. Who knows? There's a brighter future for everything, isn't there, Doug?
I'm telling you. So before it all goes,
Goes.
there could be hope, Dr. Andrew Ford. Thanks for making me feel so much better this morning, and most of our viewers. Yeah, there is hope on the horizon. That's been our topic, getting under my skin this morning.
Getting into. He's
He's
laughing.
always
'cause
under.
He knows it's into, and he's the doctor. Come on.
Oh.
If somebody's getting under your skin, it's bugging you.
Bernard, what is it?
You need a transplant, you know.
I need a transplant.
His weave is too tight. His piece.
All right. Thank you, Dr. Ford. We're going to head out to the roads now for our first traffic update of the morning.